Hello, I'm Captain Shelley Perkins, the commanding officer here at Naval Hospital Camp Pendleton. I'll be answering a few questions we received from Facebook. What advice do you have for those who are pregnant? Pregnant women should do the same things as the general public to avoid infection. Cover your cough by using your elbow or a tissue. Of course, avoid people who are sick. Clean your hands often using soap and water or alcohol-based hand sanitizer, whichever you have available. Clean and disinfect frequently touched surfaces like countertops, sinks, or door handles daily. As always, you can find additional information on the CDC's website. Does Naval Hospital Camp Pendleton have COVID-19 test kits, or are patients referred to civilian hospitals for COVID-19 testing? At this time, Naval Hospital Camp Pendleton does have COVID-19 test collection capabilities, which are being used for symptomatic patients based on clinical assessment and the CDC guidelines. Of course, not everyone needs to be tested for COVID-19, though many will have mild symptoms and can fully recover at home. If you are sick, please stay home unless you need medical care. Also, avoid exposure with others in your home and community for at least 14 days after symptoms start. This will prevent the spread of more disease. If you have questions about your symptoms, please call Naval Hospital Camp Pendleton's COVID hotline or the nurse advice line, which both numbers are located on our Facebook page. Can prescriptions for those who are immunocompromised be transferred to the drive-through pharmacy, including refrigerated medicines? Yes. Anybody can move their refill prescriptions to the 13-area pharmacy drive-thru by calling the refill line located on your prescription. When prompted, press 3 to speak with a pharmacy representative. We have also moved our pharmacy services outside of Naval Hospital Camp Pendleton, located on the north side near the parking garage, to avoid you having to go into the hospital. Another great option would be to fill your prescriptions through the TRICARE home delivery. You can register online or by phone. If you visit our Facebook page, we have all the details of where to go to register. How do you know if someone will be tested for COVID when they come in? The Navy follows the CDC guidelines, which means that clinicians will use their judgment to determine if a patient has signs and symptoms compatible with COVID-19 and whether the patient should be tested. In general, most COVID-19 patients have shown up with a fever of 100.4 or greater and symptoms of acute respiratory illness like a cough or difficulty breathing. We also look and see if the patient has some sort of connection to somebody who tested positive for COVID. For example, a family member, somebody living in your house, somebody that your child plays with who came up being COVID positive. All of those things are contact worries that we also test for. Who can be tested for COVID? Any Marine, sailor, and beneficiary that meets the criteria for testing based on the CDC guidelines can be tested at our hospital. Are civilians allowed to come to your hospital? At this time, we are seeing Marines, sailors, and all other eligible beneficiaries at Naval Hospital Camp Pendleton. Additionally, per the Assistant Secretary of Defense for Manpower and Reserve Affairs memo, Department of the Navy civilian employees that have unknown exposure to COVID-19 and presented with symptoms within the past 14 days may be seen by our hospital, as we have the capability and the capacity to do so. The employee must provide a letter from their command and a copy of the mentioned memorandum when they come to the hospital. Being a high-risk person, aka chronic disease, how can we get an appointment to get seen for meds? This is a great one for us. All patients, including our high-risk patients, are able to schedule virtual appointments with their provider for med refills as well as other normal appointments. In fact, a lot of our appointments, about 90% of our appointments at family practice as well as with internal medicine, are virtual appointments right now. So that's an easy one. If someone is an EFMP family with a deployed spouse, can more than one person come to visit? Our current visitor policy only allows one healthy adult on the labor deck or when there is a pediatric patient who has an appointment here at the hospital. This is to keep our patients and staff safe. I would first recommend to speak with your provider to see if your appointment can be virtual. You can also speak with your Deployment Readiness Coordinator, or DRC, for information on additional resources that might be available to you. You're, of course, always welcome to call our patient relations team and see if we can work something out based on a case-by-case situation. Will my husband be able to come with me when I deliver? Will I have to do this alone? You will not have to do this alone. Your husband will be allowed to go with you when you deliver. So in other words, if you're coming in to deliver a baby and your husband wants to come with you, perfect. If your husband's deployed, then another family member can come with you to deliver a baby. Is there another number to call other than the nurse advice line? I have waited on hold for hours and I just gave up. This is a great question. We know that the nurse advice line has had many calls, and that is why Naval Hospital Camp Pendleton created a COVID hotline, which is ready to answer your questions related to all things COVID. Please call 760-725-HELP and press option 6. Please be sure to follow us on social media. We posted all of our updated information there, and we can also answer any additional questions you may have. Thank you.